appreciate you reminding me about that. There we go. All right. So just so you know that that's something we will be doing on Thursday. And, you know, unfortunately, you guys can't experience that, which is kind of stinks, but it is what it is. All right. So I'm going to go to Google Classroom and I'm going to answer all Tanner's questions. All right. So the labor and delivery guided notes we're going to work on today. So that's something you should open and be filling out as we go through. And this is where Sarah raised her hand and said, hey, Miss Epka, can you record? Because if I don't get everything down on the notes, I want to be able to go back and look at the recording to be able to get that information. Okay, so that is 100% fine, and I'm so glad that she reminded me to do that. But here is the guided notes that you need to be working on while we're working through the Google Slides. So Tanner, I moved that deadline till the 17th, which is next week. So you don't even have to worry about that one, okay? So take that one off your list. And then these other two, they're really easy assignments. And I will talk about them at the end, but they're super simple. And I do have them due on Friday because of their simplicity. But Tanner, if you need more time, you know that you have it, okay? So don't worry about that. And then the stages of labor graphic organizer, I'll just talk about that briefly because that was what we would have done on Friday of last week. So after we talk about the stages of delivery today, you just need to go back and read this article, and then there's a graphic organizer that you fill out according to what the article talks about. I don't want any copy pasting. Just read it and then put it in your own words. That's all you got to do. Okay, so make sure you do that also. But we need to work on that PowerPoint first. So let's start there. So go back and pull up your labor and delivery guided notes. Okay. And have that ready so that we can start in on the note taking. Okay, so are there any questions right now as to what I want you to do? Okay. All right, so let me just preface this Google Slide presentation. So there will be times when I will stop and play a video. Sometimes the video will be somewhat graphic as to showing a live birth, so you may see some nudity, but understand that that's the whole process behind giving birth to a baby. You can always clamshell your Chromebook when I play the video, or you can just not watch it. But remember, that's kind of why we're in the parenting class, is to learn all the things that are involved with birth and to be knowledgeable about that. So someday when you're in the situation, you can decide what type of birth you want, what it all entails, and you're kind of making an educational decision instead of just making a rash decision and not knowing anything about it. So I just want to preface that before I go in and start this Google Slides, okay? And at any time, if you have questions or concerns, you can let me know. All right, so now we're going to go into the notes. So pull those out, please. Okay. Hang tight. I'm looking for something for a second. If I brought it home with me. Yay, I did. Okay. I was looking for my note page so I can follow along as well. Okay. Get this open. All right. So let's get started. I'll show you this one slide and then there's a video connected to it. So I'll have to go out of here and go back, but that's okay. We'll make it work. Okay, so the first thing that happens is a woman starts going into labor, and what do I do now? So we're going to kind of talk about that. Okay, So you follow along with your notes, and I'm going to show the video after I read through the slides, okay? So these are just some terms that you need to know. So labor is the series of events that expel the infant from the uterus, characterized by rhythmic, explosive contractions. So they are quite painful. Because the cervix is dilating, that means that it's getting to be about 10 centimeters. So if you think of an orange, okay, an orange is approximately, if I measured it, about 10 centimeters, just to give you a visual on what that is like. And the cervix, when it's dilating, it's opening up. So in class, what I did to try to describe or show this is I took a balloon and I put a ping pong ball inside of the balloon, okay? And I kind of pushed on the balloon to show that as I'm pushing on it, the ping pong ball is getting closer and closer to the opening, and it's softening up that portion right before like that little tip of the balloon. And that's what we call effacing. So effacing is that it's thinning out the cervix. It's making it really pliable and almost like a rubber band, so it's stretchable. So you got your labor. The contractions that are coming are going to help with dilating the cervix to 10 centimeters. And then effacing the cervix, making it really soft and pliable like a rubber band so the baby's head can fit through. And average labor is right around 12 to 20 hours. And I'm gonna go out of here and play the video, and then I'll come back to this slide, okay? But in order to play the video, I have to be out of here. So let me do that really quick. And I'm hoping it doesn't play on its own, so I can do that. Okay. Oh. Did it go out of presentation mode on its own? No. Okay. All right, so let me show this to you. Hopefully it'll play. Oh shoot, that's the wrong tab. Oops. Cancel that. Okay, so here we go. I think this is what I want. Okay, so here is an animated view of what labor and birth are like. And then Miss Gray, if you could just pop in and just let me know if you can't hear it or see it, please.
Yep.
In the weeks before birth, your body slows down production of the hormone progesterone while increasing production of other hormones, including prostaglandins, which soften the cervix, and oxytocin, which triggers the uterine muscles to contract. True labor contractions are rhythmic and painful and grow consistently stronger. As the long vertical muscle bands of the uterus tighten, they pull the cervix open. The strong muscles at the top of the uterus push down and release, guiding your baby toward the cervix. The mucus plug, a collection of thickened cervical mucus that sealed your cervix shut for 9 months, may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. By 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath, the incredible journey of birth is complete.
Okay, so now we're going to kind of dissect what you just saw a little bit. I know, Monica. I thought that for many, many years before having children, but once you're older and it's more in perspective as to wanting to carry on your family genetics and line, it does change your mind a little bit, but you know, it's I can't lie, it's not painful. I mean, it is painful, that's for sure. Okay. So is there anyone that's still writing on this slide so I can give you that opportunity to complete if you would
Me.
like to? Let me know, Tanner, when you get done, okay? And remember too, it's not crucial that you write every single word I have on there. Like dilation, you could put 0 to 10 centimeters. Effacement, you could put thinning of the cervix. For labor, you could say it's a rhythmic explosive contraction. I mean, it doesn't have to be every little word that I'm saying in the slide on your notes.
Did it?
All right, thanks, bud. Okay, so there's some things you need to know about when it comes to labor. There's something called the show, or some people refer to it as the bloody show. And in the cervix, there's something called a mucus plug. And it is there when you get pregnant and all through the 9 months of pregnancy. But in that last month, you could actually lose the mucus plug because the cervix is starting to soften and starting to open up. So usually if you lose the mucus plug, they say that, you know, labor is soon to come. But some people, you know, it could be a couple weeks, you know, before the baby really starts to do anything. So it is referred to as the bloody show, and sometimes it's the onset of labor, but it doesn't always have to be, okay? But it's the beginning of the cervix dilating. Water breaks. That means that the amniotic fluid that's in the amniotic sac around the baby to keep it safe and protected ruptures. And it could be that, you know, the baby hit it just right and it ruptured. It doesn't have to rupture, but if you are going to deliver the baby, the water does need to be broke before delivery. And so if it breaks on its own, you need to make sure that it's clear in color, because if it's brown, it usually is a sign that the baby has went to the bathroom in the amniotic fluid, and that's a sign of stress, and stress can kill the baby. So when the water breaks at home and you call the doctor, they're going to want to know if it's clear or not, because that's going to tell them whether, you know, you need to get to the hospital ASAP or there's still a little time for you to get to the hospital. But if the water breaks, that means that baby does not have that water protection anymore, and bacteria can start setting in and can cause an infection for mother and baby. And so as soon as you get to the hospital after your water breaks, they're going to want to start you on antibiotics to keep you and the baby safe from getting an infection. And so the baby, if the water breaks, will be born within 24 hours because that's that safety net of the antibiotics to keep the baby and mom safe. Okay. So if you ever hear somebody's water breaking, you know the baby's coming within that day. So that's just a good indicator. All right. So I saw that Caden just entered, not the Caden with the Y, the other Caden that doesn't have the Y in his name. We are on Google Classroom and we're taking notes. There's something in the Google Classroom that indicates you're going to be taking guided notes on labor and delivery. And that's what you need to pull up and start taking notes from where we are in the Google slide presentation. Okay, and then contractions. So basically, they are muscle contractions. They need to get at regular intervals, and it's something that you cannot just walk off. Okay, you kind of have to breathe through them, and it's basically the contractions are the uterus kind of pushing in, and the baby's head down on the cervix, and the baby's head is kind of pushing down to help soften or effacing the cervix so that the baby can be born. Okay, so that's what contractions are, is they're muscle contractions of the uterus that are helping push that baby and soften up that cervix. So Tanner, can I ask, are you, which one are you on, or are you ready to move forward, or was that an okay? Good.
Yes.
Thank you, sir. Okay, and then just more on contractions. It's a rhythmic tightening and relaxing motions of the muscle of the uterus. Some women will experience what's called Braxton Hicks contractions, and basically we call those false labor pains. They occur throughout pregnancy, typically involving the back, not the uterus, and they're not regular, and they can go away with exercise. Okay, so what I remember from Braxton Hicks is I would look at my abdomen where the baby is, and what I would feel is like a tightening, like I don't know how to explain, but like it's just a tightening of like your skin, like you're feeling pressure and tightness, and it just kind of feels a little uncomfortable, and then it goes away. But it's almost like the body's kind of working its way to um, learning about contractions and what it's supposed to do. And so we just call those Braxton Hicks, and they have no intensity to them as far as like pain. Like I said, it's just kind of a squeezing is kind of what I was feeling, but I wasn't in pain. Like if you're having a contraction and it curls your toes or takes your breath away, that's a contraction. It's nothing that you're going to be able to be like, oh yeah, I'm contracting. No, 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 no. You will know when it happens because it's going to be an intense pain that you're feeling. Okay. Because the cervix is opening and the baby's head is right there pushing on it. So it's not something that's going to be delightful in feeling. Okay. So I hate to tell Monica that, but it is true. That's just reality. Okay. All right, so hopefully for contractions, you just put something like it's the uterus muscle tightening, and then Braxton Hicks, you could put simply that it's false labor. It's not a real contraction that's happening. So if you did that, are you ready for me to continue? And I'm going to use Tanner as my guide to let me know that he's ready.
Do it.
Okay, so then we have what is induced labor. What does that mean? Well, some women will not start dilating. They won't have any contractions at all, and we can't just let the baby sit in there. There's a certain protocol that, they're only going to let you go for a period of time, because what will happen is if they just let somebody be pregnant indefinitely, number one, that could be very detrimental to life. But, the amniotic sac is going to break down. The amniotic cord is going to break down. These are all things that are going to happen in time, and they have to get that baby out. So, some women that don't progress, like I'll explain that I was one of those women that in my first pregnancy, I was not progressing. And so the doctor's like, okay, so we're going to have you come in tomorrow at 8 in the morning, and we're going to start you on what we call a Pitocin drip. And that basically is medication that's put in my body intravenously. So I have to get an IV, and it's going to help my body start opening the cervix up and getting my contractions more regular, stronger, so that I can give birth to this baby. Okay. Most likely the doctor will rupture the amniotic sac if it hasn't ruptured at this moment in time. And that also helps get the ball rolling. Okay. But I also at home, for my second child, my water broke, and I didn't have any contractions after my water broke. Some women do, some women don't, so Everybody's different, but usually, like I said, if your amniotic sac breaks at home, you need to call the doctor and you need to get into the hospital. Okay. So just keep that in mind. So you need to know about inducing labor, that there's a drug called Pitocin, and that they also rupture your water at that time. So let me know when you're ready to go, and you know who I'm talking about. Is going to give me the go ahead. Tanner, are you going to tell me when to go?
Oh, sorry. Go for it. I said go for it. Hello?
Are you telling me, Tanner?
Yeah. Can you hear me?
I think you're talking to me, but I can't hear you. I wonder if my earbuds are dead.
What do you mean you
Yeah.
can't hear
Let
me?
me take my buds out because I think that's the problem.
What do you mean you can't hear
Yep.
me? I've been talking to you for
All
straight
right.
hours. Can you hear me now?
Okay, hold on, Tanner. I know you're telling.
No, I think something's wrong.
Oh, I hear you now. I hear you now.
Never
I
mind.
think it was my earbuds went dead, and so you were talking, but I couldn't hear you, but everyone else could. So I'm good now. I hear you.
Okay.
Thank you. Okay, so there are 3 phases in the first stage of labor. So in the first stage of labor, there's 3 phases. So I'm just going to give you some general things with the first stage, and then I'm going to break it down into phases for you. So the first stage has to do with contractions start. The cervix is going to dilate up to 7. The average length of this first stage of labor is 2 to 10 hours, so it's considered the longest stage. Contractions will grow stronger, longer, and more frequent, and they will also need to monitor the fetus. So this is just in general what happens in the first stage, and then I'm going to break it down so that we can talk about what happens at each stage. Tanner, your mic's still on, bud.
Crap.
Then Tanner, let me know again.
Go for it.
Thank you. Okay, so there are 3 phases, and you need to remember what the 3 phases are because those would be a test question. So the first phase is called the early labor phase, and contractions will start. So you'll start getting contractions at a relatively regular interval. Early labor contractions are sometimes hard to distinguish from irregular Braxton Hicks contractions. And we already talked about those, that those are considered false labors. But true labor contractions, they get closer together as time goes on and are more regular. They also get longer, stronger, and closer together, even though eventually they'll be coming every 4 to 5 minutes and lasting 40 to 60 seconds each. And early labor will end when your cervix is about 6 centimeters. So you're in this phase at like 3, 4, but to move on to the next one, you got to be right around, 6 dilation to move on to our next phase. Early labors are early symptoms. Labor contractions are quite painful, and if your labor is typical, your early contractions will be mild enough for you to talk through them and puttering around the house or even dozing off between them. but eventually they're going to gain in intensity. And remember, this is possibly when you might see the bloody show because your cervix is starting to open and the mucus plug will be expelled. And there's a picture there that kind of shows where the head is. You can see it's right on the cervix there. And with each contraction, it's kind of pushing down the baby's head on that cervix and kind of softening it up. So let me know, Tanner, when I can move on.
Yeet.
Are you good?
What do you think the yee was for?
Say what?
It means yes.
Okay, so active labor, this is the second phase, and it's when things really get rolling. Your contractions become like more or increasingly intense, more regular, longer, stronger. You're no longer able to talk through them. They are getting more frequent. So in most cases, the contractions eventually happen every 2.5 to 3 minutes. Although some women never have them more often than every 5 minutes, even during transition, which is our second phase here in a minute. So just imagine the most intense pain possible, and they're about every 2 or 3 minutes apart. Okay, because your cervix is starting to open and soften up. The baby starts to descend towards the end of active labor, although they might have started to descend earlier or might not start until the next stage. Sometimes, though, women can feel like they are nauseous or vomit because they might get an epidural. Their blood pressure might drop. Their nerves are kind of all, firing, and it can cause some discomfort. So sometimes it's not uncommon for a female to feel sick during the second phase, which is active labor. It is possible. As a general rule, if you're a first-time mom, once you've had regular painful contractions every 4 to 5 minutes for at least an hour, it's time to call your midwife or doctor and maybe head to the hospital or birthing center. So that's really important if you feel like you're in the active labor phase. And then Tanner, just give me a let's go and I'll know.
Okay.
Okay, then you have your transition. So this is at the very end of phase 1. So this is the end. Sorry, we're at the end of the first stage, but we're at the third phase, which is transition. And that is when you have regular powerful contractions every 2 to 3 minutes that lasts up to 60 to 90 seconds. You are getting fully dilated. So this is the most intense part of labor. Contractions are usually very strong, coming every 2.5 to 3 minutes, and some lasting a minute or more. You may start shaking and shivering. Some women begin to bear down spontaneously to push and may even start making deep grunting noises. Some babies descend earlier and the mom feels the urge to push before she's fully dilated. Other babies descend later and the mom reaches full dilation without feeling pressure. And there could be a lot of bloody discharge at this time. So you can see in the picture that the baby's head is right there on the cervix and the cervix is opening. Hopefully you can see that. Tanner, let me know.
Yep.
Okay, then we have an epidural that can be administered. Okay, and usually this is done during like the first stage. And basically it's an injection in the back next to the spinal cord. And they will put some numbing. They'll do a numbing needle that puts medicine there so you can't feel the second prick as much. And this is usually given when the mom's about 4 centimeters by an anesthesiologist. And that is the person that's going to put that medicine right next to the spine. The video I'm going to show you on this can be a little bit explicit. So if you don't like shots or any type of medical videos, you probably are going to want to clamshell your Chromebook or not watch this part. But I'm going to show you someone getting an epidural. And what's going to come off of the epidural is a catheter. And basically it, I was just trying to read what Sierra wrote. Some girl in the video, you're going to see this tube coming out. It kind of looks like a shoelace, but it's like a tubing that comes out. And basically the reason why that still is sticking out of the patient is because if the anesthesiologist needs to give more medicine, then they will be able to do that. Yes. So Sarah makes a good point about being concerned about an epidural. So when you are given an epidural, and I've had 2 of them, the doctor is going to lay out anything and everything that could go wrong. And then they're going to ask you to sign a paper that relieves them of any responsibility if something does go wrong. So you as a patient are going to have to weigh the pros and cons on what you feel is best for you, because there are some risks when you have an anesthesiologist do a epidural. Okay, and that's kind of what Sierra in her comment is just letting everybody know that there are some concerns with that, and it does, there are some people that have side effects. I was not one of them. I've had 2 pregnancies, and I did not experience any of that, but just think about how many women have a baby each and every day and who gets an epidural and so on and so forth. So there are some risks there, and the doctor will let you know what those are at that time, and you will have to make that decision. So I'm going to get the video prepped, and then again, if you don't want to see it because you don't like needles, then I would say clamshell your Chromebook while the video is playing. It's like maybe 2-3 minutes. It's nothing, that's going to last the whole time. Okay. All right. So let me go out of this mode and get in the video mode so you guys can see it. Okay, here we go. All right, so this is a female getting an epidural so that she feels no pain during the labor and delivery.
Grammarly does more than
Sorry, I just shut it
catch
down.
errors. With Grammarly, you can find really good.
Okay, here we go.
Planning for an epidural, yes. I want to enjoy the last few hours. I want to enjoy her coming out. The epidural just, for a lot of women, it helps relax them. It allows their uterus to do all the work without the woman
Okay, so
fighting
this is the
against
numbing
pain.
medicine going in.
So especially at the end when mom's exhausted, I think the epidural just helps them, give them some relief.
Now during this procedure, she's still going through contractions, and she has to be very still because one little move, could do damage. So you got to be really careful as an anesthesiologist to, make sure you do your job correctly and that the patient stays still. So there's the catheter that's coming out. They're administering the medicine right now so that she's not feeling any pain. And then they're going to completely tape up her back so that it doesn't move.
Look at the power of the epidural, hun. Now you're just all smiley and glowing.
And now I can actually tell patients how it feels like.
Okay, so that's an epidural. So that you had an idea of what that is like. And then Tanner, were you ready to go on after this slide of the epidural?
Yes.
Okay. Hold on, I gotta get back into present mode. Do. It's so much fun to push a billion buttons. Yay. Okay. Back to this. All right, so moving on to the next slide. All right, so positions. There are different positions that you can be put in to give birth. Some people just want to lie back. Some people feel the need to kind of squat. Some people lie on their side. Some people are in a type of sitting position, kneeling. Some people give birth in water. So, you know, it's whatever really is comfortable for the patient. I know that when I was I was in labor for my first, I was having really bad back labor. And so they were trying to get the pressure off my back. So they had, like, if you know of an inner tube in the summertime that you sit in the water, they had me put my belly in that and try to kind of take all the pressure off my back to see if maybe she would turn, if that was the case. Unfortunately, that was not what happened in my situation. She still stayed the same way, but you know, they try to help you move in positions that either will help if the baby is not head down, or if the baby's head is up instead of down, you know, like facing back. So they, you know, as the nurse in that unit, she's trying to help make your birthing process the best that it can be by helping you. So those are just some positions that are given for birth. Okay, so now we are in the second stage of labor, which is the pushing stage. So we're able to now apply pressure and push as best we can to get this baby out. And I can't really describe, you all, as females, we have vaginal muscles, and we have the ability to push using those. If females ever do Kegel muscles, that means like you squeeze like your butt cheeks together, but it's also squeezing the vaginal wall. And so, you know, if you do Kegels, which they tell you to do throughout your pregnancy, so that when you have the baby, you don't have, you know, like it kind of weakens your bladder. And if you do Kegels, it kind of helps strengthen that. And so you don't have to worry about, you know, having a weaker bladder system. So like as you age, you know, you could sneeze and you might have, you know, urine come out or cough. But if you do your Kegels throughout your pregnancies, it keeps that muscle kind of taut, and it doesn't have that possibility of becoming weaker. And so females, you know, would have that problem. But I'm one of those females that, you know, I had issues with that, and there's a surgery that you can get that helps. It's called a bladder sling. And so this bladder sling is put in to try to help, you know, keep that muscle taut so you don't have those problems anymore. So if that does happen, like it happened to me, then, you know, there are surgeries that can help assist with that, just so you know. It's not something that you have to continually endure throughout your life. There are things that you can do. And if you have a question about that, let me know. But you know, I've experienced quite a bit during my lifetime of having 3 kids. So you know, if you have a question, I'm sure that you or Miss Gray's listening to, and she's got some different birth stories to tell as well. So between the 2 of us, I think we can probably handle the subject. All right. So we're in this pushing phase, which is that phase that we're like, okay, we can see the light at the end of the tunnel, which is great. So this is when crowning, and that's when the head of the baby is seen in the vagina, that you can see it. Sometimes forceps or vacuums are needed to be used because the baby's kind of in a position that they're not able to move forward anymore. And so a forceps is something that kind of hooks on the ear, that they kind of use to kind of move the head around to try to see if they can't, you know, get it in a position that it can be born. A vacuum is kind of a suction cup type thing that they put on the head, that they try to extract the baby that way. The the forceps I don't think are used as readily as they have been, you know, in the way past. My son was my last born, and I remember that they thought that they might have to use the vacuum, so they were kind of getting it ready. And then I gave one more push, and the head was born, so I didn't have to have that done. But I would say the vacuum would be something more in today's times that are used. So just keep that in mind. And then if you remember about the video I showed you right at the beginning where you saw the fontanelles of the baby's head kind of moving so it can get through the birth canal. So that's why sometimes babies that are born have a cone head, because of those fontanelles that have moved or shifted during the delivery. And they'll go back, you know, that's why babies have a soft spot, because their skull needed to be pliable to be born. And then as they develop outside of the womb, they will start to close that soft spot. But that's why babies' heads are so fragile and that you have to be so careful with it.
I have a question.
Yeah.
So when you said about the part, like the vacuum part, so are you saying like they have a thing to where they can like help you have your baby come out?
Yeah, so like let's say the head's crowning, but you know, for whatever reason, the baby's stuck in that position.
Mm-hmm.
It's, you know, maybe it's lodged in a, you know, certain way. And so they put this like suction cup on the head. And I didn't get to see it at work, but you could probably Google it to see, you know, what it looks like. But it's like a suction cup that they put on the head that helps them kind of maneuver that baby to get it out of the vagina so that that head can be birthed. Because once that head's out, everything else is pretty easy, hopefully, you know, with the shoulders, and then it just kind of comes out from there. So the two hardest things are the head and then the shoulders to be born.
Okay.
But yeah, it's just something that helps the baby extract. Like if you, I don't know how to explain this, but one of the nurses I remember told me one of the most parts of the birth that they think is so fascinating is like the head of the baby
Mm-hmm.
will be coming out, like, and you can see it like turning, the skull turning to try to find that special sweet spot to be able to push out the rest of the way. And that nurse told me that that was her favorite part of birth, is just the baby's head maneuvering back and forth to try to figure out how to get out, you know. And the mom's helping with that too, but you know, that's one of the biggest things. We got to get that head to be born. So the purpose of contractions during the second stage of labor is to push that baby out of the mom's body. That's what we're looking for. Okay. I'm assuming after all that I've talked about, we're ready to move on to the next one, is my guess. All right, so here's the picture. You can see that they would be able to see the head crowning. I had a mirror up behind me. Well, I think it was in, I don't know. Somehow they maneuvered the mirror so that I could see the baby's head crowning, so I could actually see it right there. So, and then one of my doctors asked me if I wanted to feel it, so I could reach down and feel the head of the baby, which was kind of weird. But anyway, you can see it because the mirrors are there if you want to look. And then the head is then delivered, so you can kind of see that. Proper birthing is the head is down. If the head was up, that means that the female would be experiencing back labor. Okay, so keep that in mind. Okay. All right, so an episiotomy. Episiotomy is a surgical cut in the perineum. The perineum is the space that's between the vagina and the anus. That is the perineum. And so if a female was having trouble birthing the head, the doctor may do an episiotomy, which is it cuts down the vaginal wall, the perineum, to make the vagina open that much more to be able to birth this baby. Okay. Some of you are probably cringing, but know that they're going to numb the area before they cut it. A surgical incision is much easier to put back together than if a female tears, because if you tear, you're not really sure where the skin was put together before it tore. And tearing can be a little more painful because there is no numbing there, you know. When someone gets an episiotomy, they're numbing it and then they're cutting it. Well, a tear can happen and, you know, can be painful because it's ripping apart. And so even though an episiotomy is you know, whoa, what's going on? They're doing it to try to help ease possible pain later. So like with one of my children, I never had an episiotomy, but I did tear a little bit for each one of them, and I would just get stitches and they would try to stitch it back the best they can. But if it was an incision, it'd be a little bit easier. My sister had an episiotomy and I was in the birthing room and it kind of freaked me out because I was what, 24. I had no idea anything about birth at all, really. And so, not experiencing it, of course. And so when they were doing it, it just kind of freaked me out. But, it was needing to be done because the birth of the head was difficult. And this is one way they can help, get the baby out and have the mother get stitched up and she's good to go. Now with any incision, you want to clean it and keep it, you don't want it to get dirty. You want it to be, well cared for. So, and a mother that had an episiotomy or had any tearing, they'll have the mother sit in a sit bath after delivery. And that basically is just a warm tub that kind of helps soothe that incision and heals it, a little bit faster and in a clean environment. So, it's nothing you need to fear, but, it does happen to a lot of females and, there's ways that the doctor can help heal that in a fast and sterile way. So, all right. So then we're at the third stage, and that is when the placenta is birthed. So the third stage, the delivery of the placenta, which is on the uterine wall there, you can see it, right? And the mother is going to feel the urge to push again, and then that will be expelled. Usually it will be within the next 20 minutes after the baby's born. It could be sooner, but they just want that to happen. And then they'll have a nurse that kind of pushes on the uterus to try to get it to contract and go back into your, go back to its normal size. Because women, after they're pregnant and have the baby, they still look like they're pregnant for a month or so afterwards, just because, it took 9 months to grow the uterus at that size. It's not just going to magically go away, even though that's what we all hope and wish would happen, but it just doesn't. So that's just how it is. Okay, I think, let me just do this one last slide and then we'll call it a day. So obstetrician is a person that deals with pregnancy and childbirth. A OBGYN is an obstetrician gynecologist. They specialize in, female concerns and also the childbirth. A midwife is somebody that is a healthcare professional, provides an array of healthcare services for women. Like they just are just more sensitive to the female's needs and wants during the labor. And they try to do things in a more natural way. Of course, you can still get an epidural if you have a midwife. If you're at the hospital, it's just they try to do it as natural as they possibly can, and also are in tune to the female's needs. Labor and delivery nurse is a person during that whole process that is with you, helping you along the way, getting you water, ice chips, checking your cervix, coaching you through, giving you different positions to sit in, lay in, getting you up and walking. So they just have a big job, labor and delivery nurses. And then a doula is somebody that doesn't really have any formal medical training per se, but they're there to kind of just help and guide the mother through her labor and delivery in a, calm environment. And, they also are in tune to mother and baby. Okay, so on Google Classroom, I need you to do the ABCs and 1, 2, 3s, and you're just going to go through and do the best you can on those. And then the other let's just say this. Let's save the home birth for next week Wednesday, and I will, Tanner, adjust that deadline to put it for next week Wednesday, so you won't have to worry about that one until then, because we haven't really talked about the different types of births that you can have. And so I'll make that due on the 17th, because we'll do it at that time. Okay. So then that only means that I need you to do labor and delivery, ABCs 1, 2, 3s. Our notes aren't going to be due until the 17th either, and that's next week. And then in down into week 5, February 1st through the 5th, the graphic organizer of labor and delivery, I would like you to do that. Okay, so you got 2 things. I don't know, Tanner, maybe you did this one already.
Did
I'm
one
gonna look-
already.
I don't know. One of them I thought you did. Okay, you haven't done this. Okay.
Okay.
I think you might have attempted it. I'm not sure. But anyway, I'll put it on the screen so you guys can see what I'm talking about. Just really quick before you go here in 2 minutes. Okay. So I want you to do this graphic organizer. Stages of labor graphic organizer. I know it says February 5th, but I'm gonna adjust that deadline for you guys. So what's today? Today is the 10th. Let's do it Friday, and that'll give you a little bit more time. And then I also want the ABCs and 1, 2, 3s right here. And then don't forget your warm-ups. But that's all that I need for Friday. Okay, so now I'll take questions. If you're understanding what I'm saying, you're free to go. If you want to stick around and go over a couple more things, I'm here to do that. So just let me know what you need or email me what you need, and I will be glad to assist you.
All right. Thanks for the info. I'll see you later.
All right, bye, Tanner. Thanks for helping me today, bud.
No problem.
Okay. Is it lunchtime? I'm starving.
I think so.
Oh my God. Okay, so I'll see you in culinary.
Yep, I will see you 6th hour. All right, bye.
Sounds good.
All right, bye.
Bye.